the flexibility of the program, it's really accommodates each of us like preferences and passion, and which I really liked.
One person may be passionate about going to work in a community health center. Somebody else wants to do research. Somebody else wants to do administration. There's a lot of different interests and paths. And so it's a combination of helping them achieve what they want. And so we're able to accomplish this really interesting dynamic where we can work as a group and have a curriculum that addresses the group for their needs.
Spoke with Dr. San, one of the previous directors at BU, and he made it possible for me to do the DPH residency as a distant learning residency, which really suited my needs. So
we had the opportunity where we can design the oral health literacy programs, like educating programs, and where we went to different sites where we educated the people on that project. It's like both ways. You're learning, and at the same time, you're also helping people who need that information by providing that information.
That having that clarity and a more focused path that the residency and being a part of BU gave to me, because I don't think that if I had done the residency any place else, that I would have been prepared or willing to take a chance to try something new and to take my career in different directions.
Someone's been teaching a class for 10 years or more, and every time they come into the class, they seem like they're doing it with the energy of the first time, but with the experience of all those years. And that combination is great.
I've never met a group of people in a department who are truly focused on student learning and student success, and not just in passing an exam for a course, or not just in being successful in challenging the board exams, but I feel, and actually I know, that they want me to be successful as a person.
This is one aspect that's very unique about Boston University, is the location. The location in Boston gives us like the opportunity to meet with kind of leaders in the field.
Boston University is a large university with a great deal to offer. There's a school of public health, there's a school of business. There are many, many parts of the university that offer seminars, that offer potentially courses that students can avail themselves of. We are also in a city with 3 dental schools plus 1 dental research facility. So even in the worst of times, we are able to share information, share seminars. In the best of times, we often have group meetings and group activities. Truly, there's no place outside of Boston that you can get that.
There's a camaraderie that exists in that program. Mm-hmm. You meet people, and those people become part of your life thereafter.
A faculty that really, really, really care for their residents and care for them when they're no longer residents. It's really a lifetime of networking and commitment to them.
I have a family. I have a BU family, and that's not just lip service or from a certificate or a BU sweatshirt. Like, that's because I am connected to people.